What kind of illness forces a king to take a day off? As it happens, Charles III has just found out, and this is what his road to recovery could look like. King Charles III is starting 2024 by addressing a common health issue for men his age, an enlarged prostate. The clinical term is benign prostatic hyperplasia, and it's something that half of all men encounter by the age of 60. That figure goes up to 90% by the time men become 85. Right now, the king is 75. An enlarged prostate can cause problems with urination, and it may be treated with medication before surgery. We don't know what other treatment King Charles has gone through to treat this condition, how long he's had symptoms, or what kind of symptoms they may be. But we do know that he arrived in London on January 25, 2024 for the procedure. A statement from Buckingham Palace read, "The king's public engagements will be postponed for a short period of recuperation." We don't have confirmed details from the palace on exactly what surgery is being undertaken, but the most common surgical treatment for BPH is a transurethral resection of the prostate.
We use various different techniques and procedures to open up a better passageway through the prostate gland.
The procedure may take up to an hour, and it can be done under either general anesthesia or spinal anesthesia. After the procedure, King Charles will likely be hospitalized for 1 to 3 days, and he'll need to wear a catheter to drain his urine for a few days. TURP surgery has been used to treat enlarged prostates for decades, and it's a minimally invasive procedure that doesn't cause much post-operative pain. King Charles will likely be visited by his doctor in the days after the surgery to have the catheter removed, assuming it's still in place after he's discharged from the hospital. That will also be the time to make sure that everything is healing properly. Charles, like others recovering from TURP surgery, will likely notice some blood in his urine for a few weeks. The king will undoubtedly be encouraged to drink plenty of water and lay off any alcohol and tea for those weeks too. He may also be advised to do Kegels and other pelvic floor strengthening exercises, since they can help speed up the recovery process. It will likely be a week or even 2 before King Charles feels ready to be back at work. However, it stands to reason that he'll try and get back to work as soon as he can. He's certainly not likely to milk his time off. If he does get back to work within a couple of weeks of surgery, Charles will likely still have more recovery time behind the scenes, since it can take TURP patients 4 to 6 weeks to fully recover. The king has been praised for being open about having surgery on his prostate, as the royals typically keep their health issues private. Notably, Google searches for enlarged prostate spiked after the January 17th announcement of the king's condition. Men may not typically feel comfortable talking about their health problems, particularly the prostate. An increased awareness could help more men get tested, and more testing could lead to catching more serious issues sooner. Ali Orhan, chief executive of cancer charity Orchid, told the Daily Mail, "Anything that shines a light on prostate conditions like this can only be a good thing. It shows men that this illness is not a sign of weakness. Even a king can have a condition like this." Raising awareness and helping to normalize prostate problems is part of why King Charles was so open with sharing details about his health. It also helped stave off speculation about his health as he takes time off from work. This is basically the opposite of what's happening with Catherine, Princess of Wales. Her hospitalization for planned abdominal surgery was announced the same day as the king's surgery, but further details about her surgery have not yet been released.